7 over-the-counter medications that are safe and effective for cats. Hello, welcome back to my channel. If you're new, welcome. Click there to subscribe, hit the bell to sign up for notifications, and then when you click that link directly in the box below, I can send you a copy of my free book. Pretty commonly while I was in practice, I'd often hear, "Doc, my cat, he's sick at home. What do you suggest that I can give him at home? I can't come in." The big thing with our cats is they really are not small dogs. They have a very different metabolism, and there's some drugs, such as the anti-inflammatories, aka aspirin, can be very safe for our dogs. You can never give that to your cat. These are 7 of the more common ones that I've recommended, and they're cat safe. Number 1, the very safe and effective over-the-counter antacid Pepcid. The name of the drug is famotidine. This drug I recommended a lot in practice. Found it to be really effective for cats that have upset stomachs, they're vomiting. You want to give your cat something for vomiting, you should be considering Pepcid. One of the more common cat conditions is renal failure. And these cats, when they have kidney disease, they can feel really, really nauseous. And the one drug I often found to be really effective for these guys was Pepcid. This Pepcid, the standard tablet is 10 milligrams. The standard cat dose, it's a quarter of a tablet or 2.5 milligrams per 10 pounds of body weight, 2 to 3 times a day. Number 2, your cat has an eye infection. Consider this Polysporin For Eyes. Your cat has red inflamed eyes. He or she likely has conjunctivitis or an eye infection. The Polysporin For Eyes, it contains the antibacterials, polymyxin and gramicidin, and both of those are reasonably effective antibacterials. They can help treat many of the cases of cats with conjunctivitis. You can just be putting in 1 drop 4 times a day into each affected eye. Do that for 5 to 7 days, and that should treat most bacterial eye infections. Number 3, the antihistamine chlortripolone. The name of the drug is Chlorpheniramine. Great for our cats that have allergies. Your cat's itching and you're wondering, is there something I can give him at home, like some type of anti-itch medication? Chlortripolone would be one I'd have you consider. These here, they're 4 milligram tablets. They're little guys. The standard sort of cat dose is 2 milligrams, 2 to 3 times a day. So Murray, he'd be getting half of this tablet 2 to 3 times a day. Number 4, antiseptic flash that I used in veterinary practice, Chlorhexidine. This surgical scrub Chlorhexidine, it's proven to be the best topical antibacterial. And if you're trying to deal with a cat that's had a puncture wound, potentially had an abscess, you should be first flushing it with Chlorhexidine more than anything else. Now I'm just squirting in a couple pumps and 2 or 3 tablespoons of water here. I've got my little syringe. I'm going to draw up some of this Chlorhexidine solution. I'm not going to flush Murray. But if Murray had, say, a puncture wound here, on the side of his neck, I suspect he's about to have an abscess, I would clip it, and then the next thing I would get would be this syringe with Chlorhexidine. I would be flushing and flushing that wound. And that's the biggest thing that you can do to prevent this from turning into an abscess. Like the principle of flushing it with an antiseptic, specifically Chlorhexidine. Number 5, for cats with red areas of inflamed skin, hydrocortisone. Wouldn't be uncommon. I'd see a cat scratching the side of their face. Maybe they have a food allergy, secondary skin inflammation. Feel free to pick yourself up some 1% topical cortisone. Squirt a little, about 1/4 of an inch on the end of your finger. Lightly cover that area. Do that 2 to 4 times a day for 7 to 14 days. Number 6. It's the antihistamine Benadryl. Benadryl can be used for allergies in our cats, being an antihistamine. It can also be used as a mild sedative. And also it's specifically being used for anxiety in our cats, being an anti-anxiety over-the-counter medication. So one of the more common reasons cat parents are seeing veterinarians, their cat has feline lower urinary tract disease. And one of the more common causes of FLUTD, it's anxiety. They're anxious for some reason. Maybe there's a new cat in the house. Something is changing in their routine that causes bladder inflammation. If you can lower their anxiety, you can go a long way in treating FLUTD. And Benadryl or diphenhydramine actually works as an anti-anxiety medication in our cats. The standard Benadryl cat dose is about 1 milligram per pound, 2 to 3 times a day. These Benadryl tablets are 25 milligrams, so Murray would be getting about a half a tablet twice a day. Number 7, this is the one over-the-counter medication you could safely give to a cat in pain. This is Robaxin, the name of the drug, methocarbamol. You cannot give any of the over-the-counter anti-inflammatories to cats. Tylenol is extremely toxic to cats. ASA, also very toxic to cats. So none of those can be safely given to a cat. But methocarbamol, sold under the brand name Robaxin, that would be the one painkiller which is safe to give to your cat. One big caveat here is you have to ensure that it's just Robaxin or methocarbamol. Typically it's sold for people as Robaxacet, so it may have Tylenol in it, it may have ibuprofen in it. So you have to make sure that it's just the muscle relaxant methocarbamol. Typically you're going to get the Robaxin in 500 milligram tablets. Standard cat dose is about 10 milligrams per pound twice a day. So a 10-pound cat would get about 100 milligrams. It's about a quarter of one of the 500 milligram tablets. They're pretty big, so you just kind of quarter this guy here, and you'd be a quarter of a tablet twice a day. There are 7 safe and effective over-the-counter medications for your cat. Click over there to subscribe, hit the bell to sign up for notifications, and then when you click that link directly in the box below, I can send you a copy of my free book.